Yeah. Hello, everyone. Welcome to another monthly edition of PCQuest Health Tech Talks. We have this at the end of the month every month. We've been doing this for quite some time now. So this time, the topic we are looking at is the key role of AI in healthcare. Now, as I say, the last 2 years, it's been really troubled times for us. But the hospitals, the medical fraternity, everyone stood up and they have almost taken us out of this crisis. But I think the biggest takeaway of the last 2 years has been technological acceleration. The rapid pace of digitalization, and digital transformation. And I think nothing is more seen in that than the healthcare. Healthcare requires a greater amount of technology, more no touch technologies. And as I say, we were nowhere near universal healthcare, but health tech care is getting us there. So I feel that universal health tech care can come to India this decade because it can work at scale, it can go to remote and rural areas, and I think finally we can dream of having healthcare for everyone. So when we talk of health tech and healthcare, there are many components, but probably one of the most important components of that is artificial intelligence or AI. AI can be the sutradhar or the central authority that can orchestrate everything and get us to universal health tech care. So we have a star-studded panel with us to discuss this burning issue, and I'm really looking forward to their insights and solutions for India to go forward. So I'll introduce the panel one by one. We have with us Reshma Suresh, Head Business Operations, Qure.ai. Welcome, Reshma.
Thank you. Thank you very much, Sunil.
Yeah. And we also have Baljit Singh, co-founder and CEO, Simbo.ai. Welcome, Baljit.
Thank you, Suresh, Sunil, and hello, everyone. It's nice to be on this panel. Looking forward to it.
Yeah. And we have with us Arun Mallavarapu, co-founder and CTO, Fedo.ai. Welcome, Arun.
Hello everyone, nice to be here.
Yeah. And finally, we have Subhashis Banerjee, co-founder and CIO of ARTPARK. Welcome, Subhashis.
Thanks, Sunil. Hello, everybody.
Yeah. So actually, I think I'll just jump straight to it. So I want this to be as informal as possible, and as and when you want to speak, you can speak. I mean, I don't want anything to be in any particular order. So I think the first thing what I would be interested before we go forward, as I said at the beginning, I think that health tech care AI is going to take us there in the next 10 years. But before we go forward, let's look back a little. Now, if you look at the last 2 years, what has been the most successful AI implementation in the healthcare system? What was the best implementation since the pandemic broke out? And how and why do you think that particular AI implementation worked? So I think anyone can go first.
Okay, maybe I'll go
So I
first.
think
Yeah, sure. Yeah, I think ladies first. Let's start with Reshma. Then we'll come to you, Baljit. Yeah.
Sure. So, I echo the sentiments. When the pandemic started, right? One thing that really worked, or what happened is there are several technological companies that came forward to support the healthcare system, and it was not with the existing offering that they have. Many of them kind of extended the offering or introduced innovations in what they already have. If you look at examples for, like, say, pharmacy or MFine, where some of them, Malbio for that matter, and I'm not talking about AI only, but health tech in general, that came forward, right? And so even at Qure, when we started working on, so we are a AI based company. What we do is we build products and platforms for healthcare diagnostics, so across different disease areas. And even at Qure, when it started, so we have solutions that can look at different findings, clinically relevant findings in, say, X-ray. We were looking at multiple lung health diseases, but COVID-19 is not something that we had seen till then. But when in last March, that is 2020 March, we also kind of repurposed our existing software, existing solutions to look at indications like COVID-19 within a matter of few weeks, and was able to quickly roll it out. So we worked with, the Municipal Corporation of Greater Mumbai, and where our solutions were adopted in hospitals. We worked, apart from that, we worked with several other government and non-governmental institutions, many private hospitals in India and across the world. And so initially, we were, working with all these metros, the hospitals in metros, and Mumbai for very closely in Mumbai as well, working with the government systems. And there are three things that we worked with or we looked at. So one is that from the X-rays, can you identify indications of COVID-19, especially when it comes to asymptomatic cases? And I still remember we had these in Mumbai. There are these jumbo facilities, which are facilities like stadiums that are converted as isolation centers or quarantine centers, etc. And they have X-ray machines, CT machines, healthcare practitioners, like an army of people who are taking care of patients. So initially, during the first wave, there was also this quarantine. So if you identify someone who's a contact, they're immediately quarantined in this facility. So and that was also the time where PCR kits were not readily available. So using our technology, what they did is that they looked at when is it that an individual, a contact, is developing some issues or having an issues in their lungs. Are their lungs getting affected, right? And immediately they are prioritized for PCR. So a lot of optimization happened. A lot of identification of cases who would have been missed otherwise happened. So there were these large vans, which were also like funded by IIT Bombay and all, which went into communities like these are slum areas, which are like really high risk of cases. Well, one person gets it, the entire community gets it. So it went there. There were X-ray machines, screened everybody. So so many innovations were also introduced by government for that matter. So we worked with that. Apart from that, there were hospitals where our solutions were used for, say, progression monitoring. That is, if someone is having COVID-19 and in isolation, then at frequent intervals, their X-rays are taken to see if there is any change in their lungs. Are their lungs getting affected, right? Because CTs, doing a CT every day, morning, evening, is practically not possible from a sanitization protocol and all of that. So these were some of the things that we worked with. Like I said, initially everything was in the metros, but then soon we realized that the problems, there is a large percentage that is ignored, which is rural India. It was not covered in media in the beginning, right? That attention was not there. And these are hospitals where patients are, they cannot afford as much. So, and this will be run, this will be like 150 or 100 hospital. They don't have specialists. The nearest PCR testing will happen after, like within a 50-kilometer radius. And this will be like run by one, say, a passionate physician. But the problem is that the case overload, there were also circumstances where the entire hospital was shut down because all the healthcare staff was affected. So this is where we could also introduce our technology. So put together in about 18 different states in India, we were able to scale our technology. What really worked, and I believe what really helped companies or innovations like us is there were also organizations or even venture capitalists who had funding, like an impact funding that they created. This includes, say, Sequoia or United Way Bangalore. There were funds through, say, ACT grants. This is how they mobilized the funds. So ACT grants or through India Health Fund, who came forward to start supporting these innovations like us. So which helped scale, which also facilitated a lot of conversation with government, state governments, central governments, and so on. And a lot of international organizations such as, say, USAID or Global Fund were also flexible in, mobilizing the existing funding that a non-governmental institution or a government is operating in towards COVID. And also they chipped in a lot more funding so that the COVID efforts or the COVID can be combated. So I think put together all of this has been what in our journey, Qure's journey that we have seen. We were also able to, with all of this support, quickly release a Telegram-based application for all physicians in India, where you just upload an X-ray and within a few seconds you will get what are the findings in the X-ray, which we believed helped empowered a lot of frontline healthcare workers. So I'll stop here and would love to listen to our other panelists.
I think Baljit, you are about to go first. Okay.
Sure. Thank you so much. Very, very insightful talk by Reshma. I do not have a specific use case which we worked on, but in general, I kind of echo with, Reshma, that it's basically one specific area where we have seen in last 2 years quite a bit of advancement in, AI implementation specifically is in the medical diagnostics. Okay, AI in the medical diagnostics. So, there are various companies who have been able to deploy solutions which help in early diagnosis. For example, if you look at where AI is helping, per se, you can look at lakhs of images and find patterns, which are not seen by, even humans, right? And you try to figure out those patterns and, try to come up with some annotated data, for clinicians or for doctors or for radiologists, so that they can diagnose, much effectively, and sometimes diagnose much earlier than they were able to do earlier, especially in cancer and all that. So this is, the area where we've seen, quite a bit of implementations. Also, I think, if I may say, which Reshma also, touched upon, is putting these medical diagnostics into into remote settings, right? I mean, if you look at India, either rural or globally as well, there are many underserved population which do not have access to resources, or doctors or radiologists. So if you can actually provide a layer of automation, at least in terms of figuring out who needs the attention, right? And proper escalation can be done. So that is another area which we have seen, especially kind of a provisional diagnosis, in the remote settings, where having a real or a human clinician would be very, very costly, and not even possible in some settings. And that's where kind of AI takes over and try to help. So this would be my perspective, or one of the areas, or the most successful in my view, implementations in last 2 years. Not very tied to pandemic though, but that's what I would have to say.
I think Subhashis, you're already unmuted. Maybe you can go next.
Yeah. So I was quite happy hearing what Reshma was saying. So we launched something very similar. It was called X-Ray Setu. X-Ray Setu was a very simple thing. X-Ray Setu was a WhatsApp number. You take a photo of an X-ray, send it to that, and we would send back the diagnosis within 2 minutes. So some of the other things have already been covered. Let me cover some of the important things. First thing, since we are talking technical here, to create any kind of AI, you need very high quality database and you need annotated databases. So I don't know what Reshma and her team used, but I can tell you honestly that unless the NHS had created some very high quality databases and given it out for free to the entire world, we would not have been able to build X-Ray Setu to the accuracy that we built. So as we go along this journey of AI in healthcare over the next few years, the importance of database will become critical. And let me tell you one more thing. If my model is developed on a database which is completely, say, a European Caucasian database, there is no guarantee that it will work on an Indian population. So for me to get better accuracy, for us to do better diagnostics, I think we need to build databases in this country to that quality. And initially that will need help from the government. First thing. Second thing, for X-Ray Setu was completely free. Okay, so anybody could send the picture of their X-ray and we would send back a diagnosis. So in fact, at the peak, we got requests from 18 countries. So we asked some of the legal people. So we sent back reports with appropriate all kind of legal that this is not constituted as a medical report, because medical is a very regulated field. Initially, we thought whether we should even reply to these non-Indian numbers. But then we took a call that, okay, this is a moment of crisis. We can add enough legal ifs and buts and send it out, because they also don't care about the legals part. So the other part is, once I have my initial infrastructure cost is whatever it is, I need a certain amount of doctors, technicians, AI people to make the models. When I'm running it and it's already running on the cloud and everything, my marginal cost to do one extra X-ray is hardly 1 rupee 60 paisa. So, for example, in May, June, when we used to get something like 3,500, 4,000 X-rays a day at the peak. So the good news is by December, that number went down to 11 X-rays a day. And that too, out of those 11, 5, 6 would be from doctors who are just basically testing. So the one reason why I have been and we have been happy in this Omicron wave is that our numbers haven't gone up. If things had been bad in the rural hinterland, then those numbers would have shot up again. But the important part is, you are talking about rural healthcare. By marginal cost of delivering another 1,000 X-rays is negligible. Whatever cost I have as in upfront is there, that doesn't change, whether it is technician, cloud, whatever. But the marginal cost of doing another 1,000, 10,000 is very, very little. So that is how you make a tech company like a Google or a Facebook. So theoretically, yes, it can be used to provide healthcare to the masses at a very low price. Thirdly, forget pricey doctors. If you look at radiologists in India, I'm sure Reshma faces that problem every day. They don't exist. It's as simple as that. So I think the total number of radiologists in this country is some 4,000 or 5,000. And that too, if somebody has data, 90% of them will be in urban areas. We have 6,400 primary healthcare centers in this country. By law, each of them is supposed to have an X-ray machine. As we found out during this pandemic, 60% have working X-ray machines. That is still a lot. But out of them, 95% do not have a radiologist. So these are the functions like radiologist, anesthesiologist, critical functions, you will not find them. And if somebody is good, the European or the American system will recruit them at $500,000, just like what is happening with our nurses. So ultimately, it is not about the cost. Ultimately, it is about both cost and availability. If we have to take healthcare to rural, if we have to take healthcare to third world countries across the world, there is no other way than AI. There will always be doubt of what is the accuracy. So you go to a village. What do you think is the accuracy rate of the quack who actually does the diagnosis there? Simple things. So, for example, a fracture, an X-ray of a fracture, and AI cannot misdiagnose it. It can give you 99.99%, if not more, accuracy. COVID is more complicated. COVID is much more complicated. I won't claim that kind of accuracy, but for simple things. But you will know hundreds of cases in a rural setting where a fracture has been misdiagnosed or intentionally misdiagnosed because somebody wanted to earn money. You can prevent that. For a lot of simple things, these technologies can work at a very high level, and definitely better than the level at which the local quack / doctor / compounder / whoever is doing it is doing. So now another part. India is a very diverse country. So what do I mean by diverse? Because something which was not good for us for many years, castes didn't marry within each, outside of each other, religions didn't, there were no inter-religion marriage and all that, meant that we have distinct genetic phenotypes. So Thakurs in UP versus Brahmins in Tamil Nadu, they are genetically different because intermixing didn't happen. Whatever intermixing is happening in the last 30, 40 years. What it means is you have tremendous genetic diversity. That is not true for any place on this planet other than Africa. Europeans don't have diversity. US doesn't have diversity. China had diversity 50 years ago before Mao decided that I will stamp out this diversity, which they're still stamping out. So if we develop AI in this country using that diverse genetic database, that will probably work for the entire rest of the world. So we are the only country in this entire universe, entire planet, I don't know about universe, which has both high-level AI talent and diverse data. Africa has diverse data, they don't have high-level AI talent. We are the only country, and we can make and sell to the entire world. So whatever you are seeing, whatever prosperity India has had in the last 20, 25 years is largely a function of the IT revolution. you can similarly empower and prosper another 20 years simply by doing a healthcare revolution. Make here, sell to the world. So I'll stop there. I think I'm going on.
That's quite ambitious. I'm really happy that all of you startup founders think so ambitiously. That's how we're going to go forward. So, anyways, I think that's the last word of this round is to you, Arun.
Okay, yeah. So I've heard this, and I think very interesting use cases, very interesting application. Mine would be very different, but maybe along the lines of Baljit a little bit, where we are not looking at imaging and radiology when we look at AI, right? Uh, See, I think healthcare and AI today, when I look at the implication of AI in healthcare, it is it seems as if the focus is always on the diagnosis side. The focus is always on the side of saying, okay, I want to be able to make a doctor's life easier. I want to be able to make it more easy for the customer, for the doctor to be able to do this faster. I think the trend which is going to shift with the Zen X and all the others is going to be that we have to focus more on the customers. I think my voice is low, is what someone said. But can you guys hear me all right?
Yeah, we can hear you. You can continue.
Okay. So I think the focus should shift more towards healthcare on the customer side, on the consumer side, right? What can the consumer get without visiting a doctor? What can the consumer get to know without actually spending the time, money, energy to go visit, get a live diagnostic test done, or something that he can actually get to know about his health proactively, which will over the time reduce the cost and pressure on healthcare systems within the country, right? That is the focus area. I think that is where healthcare should probably go forward, right? It is right to be on the diagnosis side today, but as we evolve as an AI entity, I am calling India as an AI entity here, right? As we evolve, we should look at becoming more consumer centric. AI should be more consumer centric than the business centricity that it has today. Correct? Once it becomes that, that is when it will actually have a real impact on end customers. And the adoption today is at a lower level because majority of the doctors don't trust AI, right? You cannot go and tell a doctor who has been doing things from the past 15 years that I can do this better than you with a system. And adoption is going to be low, but I think it's the bridge between the increase in adoption versus the time that it takes for us to build those sophisticated models is going to the consumers. Once consumers start adopting it, like today everybody is Google rich when they go to visit a doctor, right? They have already Googled their condition. They are already going and telling me. Most doctors even complain that they want this specific medications also, right? That's how people are today. So I think we have to make AI more focusing the consumer and saying, yes, okay, you can take care of your health by doing ABC, right? And that's a journey that Fido as an organization is towards, right? Where we are making it more customer centric, where we are saying, can you find out the risk for yourself, for your health in the future? And can you look at your regular vitals on a regular basis without really going to a doctor, right? Can you check your heart? Can you check your probably your hemoglobin levels, etc., without really going to a doctor, without really pricking yourself on a regular basis, so you know where you stand today, right? And as that becomes more and more ubiquitous, that is when we start looking at, okay, this can become a standard for people to be able to adopt it. So that's my view, that healthcare today, AI in health is there, is has been there, is there, and probably will be there. I think the focus is what we need to look at. Where is it going to be trending towards? It has been trending towards diagnosis. I think the shift is going to happen more towards customer enablement and customer benefits.
Yeah, thank you. So, thank you all four of you. That was quite fascinating. So, we got AI for the consumer, AI for the customer, AI for the doctor, and even the AI as your radiologist, and an AI as an export, quantity. So that's good. So I think now let's, since we have done the hits, I'd just like to look at the misses. So what about the misses? I mean, has there been any global healthcare solution we have been missed? Now, usually when you miss something, you don't know that you have missed it. You can't talk about it. But here, because the entire all 200 countries in the world have been struggling. So have you seen any country, they did it and we didn't? And if that's the case, then how can we make it work in India? That would be a more interesting solution.
Sure. If you allow, I would like to go
Yeah, please,
first.
please, Baljit,
Okay.
this time you can go
Great.
first.
So what we feel, the one area, which has been a big miss and is also critical into, any of the stuff which you do. For example, I heard Reshma and Subhashis talk about, diagnostics, and for any AI, you need data. And diagnostic is, one thing where you can get, digital data, because most of it is generated by machines, and you have it at handy, and you need to just compile, various annotations along with it and try to do it. But if you look at, other aspect, for example, what Arun was trying to say. Now, if Arun wants to build solutions, which could actually predict whether a patient, would have some trouble, much before they actually have a trouble, you actually need data. Now, where is that data? Right. And this is one big miss, I see. For example, if I look at the Western world or even European countries, they have been, have successfully adopted EMR, of course, EMR without AI, and then AI kicked in, being as simple as speech to text, okay, to, as complicated as, kind of, doing macros or helping doctors do, stuff very, very quickly. So this is one area, which we feel is a miss, and it is miss not just for, EMR perspective, but it's a miss for everybody. Because now imagine if, Reshma and Subhashis have, along with the diagnostic imaging, a complete EMR record, right? Or Arun has complete EMR record, of course, redated, redacted without having any patient information, and they could do, a lot of analytics and all that. And this is exactly the area, which we have been focusing on. Okay, so at Simbo.ai, our efforts are towards, creating voice-based digital assistant for doctors, where, they actually talk, doctors actually talk to, Simbo as if they're talking to a real human, and it would actually understand the whole aspect of it, identifying what doctor is trying to mean, as if you actually had a human assistant. And it will take all those actions, and ensure that doctor doesn't have to touch keyboard and mouse at all. Now, why did we decide to do that? We decided to do that for the very same reason. Somebody has to work towards fueling the data, because if we do not do that, yes, India is a big country. We have so much of variety. We probably do multiple billion consultations per year, right? But what to do with it, right? If you do not have all that data, stationed. Now, imagine having great AI talent, having diversity, and data also being available, right? All the clinical aspect available, what it could do. So, my take would be, this is one of the biggest myths which we have, which many other countries have mastered, by some or the other. And this is something I think we should look forward to as we move forward.
Great. Can I go next, Sunil? Yeah. So I think, Baljit, you touched upon a very important point, like the creation of the data. And I would say today, after NDHM, I would say it is not a miss. Probably the miss has just been corrected, or at least the attempts to correct it have started, right? With NDHM starting off on that note, where they want to digitize data and keep centralized health data of all individuals, I think it is going to become a gold mine for Indian healthcare if it is successful, right? Again, there are ifs, we understand, but again, it's a good step forward. So miss on that front is yes. We have started off and probably we are starting on that front. Another big miss in on my side, and this is probably something that a lot of the Western or probably at developed countries are doing in our academics, in our medical schools, in our uh, engineering schools, right? I'm not seeing that much of a knowledge being built into the medical community on the use cases of AI, right? If we look at that aspect, and that is one of the reasons why doctors don't trust the system, right? You cannot go and try to explain a true positive, false positive, and an F1 score to a doctor, then it's difficult, correct? But if that education is imbibed at the academic level, where physicians understand it, they don't need to be data scientists, but they broadly understand the broad strokes of how it works, right? The adoption and finding use cases where it will work will be much more higher, because what is happening today is data scientists are trying to create use cases in the healthcare ecosystem. But if doctors create those use cases and feed it back to the data scientists with the appropriate thing, okay, you don't need to be 99.99% accurate on this one, right? You can be 75% accurate and still adds value. Those kind of use cases, if it come from the industry rather than from the data science side, I think that is going to be a huge win to make the adoption and prevalence of AI within healthcare much bigger. I think that has been a big miss that we have seen, right? And similar thing has happened in the Western countries, where they're actually utilizing some of the tech to say, okay, I can do minor things. I don't really need to be 99% accurate, but they are doing some of that stuff which we have probably missed the boat on. We should catch up.
Subhashish, you're going next.
Yeah.
Sure.
So one, two things which I'll add, and then I'll get into what I wanted to say. What Arun was saying, that is unfortunately a design mistake. In India, medical colleges are standalone institutions. They are not part of a larger university. What do I mean by that? So if you go to the US, Harvard Medical School students can take courses at MIT and do so. MIT students can take courses at Harvard Medical School and do so. Innumerable such examples in Berkeley, in the University of California system, in Oxford, in Cambridge. So, unfortunately, in our country, the medical colleges and the engineering colleges are not integrated. You need to have had exposure for both sides early on for this kind of thing to happen. So, hopefully, we will change that. So, right now, we are building a school in ISC Bangalore right now. IIT Kanpur has also announced plans for that. So, hopefully, that will also happen. So, hopefully, things will change. So, yeah, in terms of miss, one thing which nobody in the world has done with all this debate and everything, and something which we can relatively easily do. Have you ever seen data on all we hear? So many people got COVID, so many in hospital, so many died. Exactly every day, why is the number not published? How many were unvaccinated? How many were single vaccinated? That data is available on CoWIN. Unfortunately, nobody has access to that. If you give me access to that, that doesn't even need AI, that is data analytics. I can do it with two decent level tech resources in 14 days. That is the data the entire world needs. All we had to do was publish that data, and that is how you silence all whatever nonsense is happening in the entire world. US has political reasons, that's why they won't publish that data. In US, the divide is too deep, but we could have done it. It is not a political issue in India that how many are vaccinated. It's not that we have a large anti-vax so-called number of people who are campaigning. So if we had just done that, we could have, even if we do it now, we can get global leadership. We are not doing it. That's a amazing use case of what we can do with healthcare data. And what Baljit was saying, if we don't create the databases, then whatever advantages and all that I was talking about will remain in dreamland. So we have to create those databases, but I have slight difference. I would rather that private sector create it with government help, even though I work very closely with government, rather than government create it and own it. Because if government creates it and owns it, the tool sets which you need to access that, if government holds the keys to those tool sets, you will not get anything useful done. So you will keep debating about, oh, privacy, this, that, nothing will get done. And if you expect that a doctor will be able to write tool sets on their own to deal with a large database created by government, not happening. Database is one thing. You need a whole layer of private companies on top of that, which will provide you the tool sets so that you ask questions in English, they will provide you the answers. That's a whole lot of SaaS companies. That if that doesn't happen, that database is of no use. Sorry, I know that the first step is to create data, but it has to be done in a proper manner that private sector can utilize it. Otherwise, not of use. So I'll rest there.
Sure. So I think again this time last word is with Reshma.
Yeah, no, very interesting to hear. I don't have anything more or different to add from what Subhashis or Baljit or Arun have already covered. Because I mean, whatever they've mentioned is very relevant, and I'm glad that it is brought up in a forum like this, and then we kind of invest or we start thinking about creating these databases, which will be beneficial for everybody. That is how it would be. I'll probably talk about very briefly one thing that I personally felt that we could have did a little bit more differently, not better or for worse, is that several other countries, if you look at it outside of India, right, there were very technology-driven tight contact tracing mechanism that happened. Be it like if you go to Singapore, just like how our Arogya Setu is, there is I think Trace Together, which use like GPS based or Bluetooth based technologies to see who is connected to whom, or which is the contact and what is happening with that contact. If that contact is moving, then have alerts that are there. Or if someone is developing symptoms, who is at risk and who is not at risk, etc. Right? So this is what one thing that I felt maybe we could have done. I mean, even for us, we actually worked in GCC with one of our products. This is not radiology, this is not diagnostics, but something a little differently. So what we developed is a kind of like a chatbot. And what this chatbot does, and it integrates with all messenger platforms. And what it does is that, we particularly worked in Oman, and in Oman they had these wearables, which for everybody, right? And then this will track the location and so on. This information was fed to our system, and what we did is that the chatbot reaches out to individuals, and it is multilingual, so English, Arabic, all of that, and then it reaches out and then start asking some questions to these contacts to assess what their medical condition is today. Like for example, like a 14-day period, which is like the isolation period or an observation period, right? The chatbot, based on the WHO guidelines, keep asking like, how are you feeling today? What's your temperature? What have you, is the temperature this much? Or are you feeling these symptoms? And there is a routine, right? And because based on what you select, there is a different loop of questions that get asked. And then at the back end, there is this algorithm, which makes meaningful sense of this information and alerts the healthcare system that, hey, you need to probably look at these individuals. This is the hotspot. These guys are at risk. Probably we need to get them tested immediately. Similarly, individuals who are under isolation, right, who are infected with the virus, not everybody need to be brought into the hospital. Some symptoms are mild, some symptoms are even asymptomatic. So the hospital bed utilization was also to large extent, we were able to do that in the sense that keep monitoring individuals, how their health system, is their symptoms worsening or like progressing or improving, and if there is a problem, then alert so that they can be moved to a hospital. I think, if we had brought in something like this, it would have worked well. Similarly, even now, what are the long-term effects of COVID, right? Or how is vaccine performing? Are we looking at, so we are now talking about booster doses. Many developed countries have already done with booster doses, right? We are still starting off that. But how many such booster doses? What are the adverse effects happening? So with the same, tool, we were able to kind of develop a tool which could also monitor vaccine side effects or adverse effects after a month or 2 months and so on, which was also one of the technologies, 1 out of 4 around the world, which was kind of technically evaluated by WHO, and we were selected, but we never implemented that at scale in India. But I mean, maybe because I think India is vast, right? And there is no standardized way in which we operate. Like every state has their own innovative methods. Central, there are certain standards, guidelines, etc. And probably the demographics that we have, maybe there is no one size fits all. Probably that's why this didn't happen. But looking forward to these kind of similar everything tightly integrated together technologies coming up. I mean, when everybody else was saying, one thing that I was thinking is that, so right now where I'm talking, I am in the UAE. I'm in UAE. I'm not in India, and I'm stuck here because of COVID. I came to UAE and then I got COVID, and I'm here for the past 20 days. Now, every time I took a PCR test with my passport number, uh, everybody knows, right? So I gave there was one mobile number of a friend because they wanted a local number I had given first time. The second time I repeated the test, I had given my number, but they still traced it with the passport number, and then that person got a message that I'm still, PCR positive. And there is another app which is for the Abu Dhabi government, and even before I got the reports of my PCR, it got reflected there, right? And the status got reflected there. And this is all interconnected. So we'll also need such interconnected, interoperability or interconnected mechanisms. And if we do that, there is a lot more we can do in India as well. But yeah, I'll probably stop here.
Actually, I think a lot of issues came out, but for me, the takeaway, the main thing is data. Data continues to be king, and I think there's so many issues around data. Importance of correct data collection and data annotation, data accuracy, data accessibility, data interoperability, connectedness and integration, data privacy. I mean, we really have our task cut out. And obviously, like you mentioned, we needed a greater government and private partnership. But it's nice all these issues have come. So I think hopefully on the foundation of data, we can build a great AI healthcare system. But probably one interesting thing is that problem with AI is, I think Hollywood has taken the entire mind share of everybody is introduced through AI only through Hollywood. Skynet is going to take over and destroy the world, and Ultron is going to take over the world. So I mean, Hollywood in a way it's propagated AI and also done a great disservice. And it is a fact, when you talk of like you go to a hospital and say AI, first he starts thinking of those Hollywood movies. It's a wrong thing, but it is a fact. So I'd just like to know that how would you counter these fears? And of course, there are also pitfalls of AI. It's not that everything is hunky dory. Things could go wrong if we don't implement the AI solutions properly. So how can we educate people, and how can we make sure that the negative things of AI don't happen?
So, Sunil, before we comment on that, if you permit, just one comment on what
Yeah.
Reshma said. So,
Huh.
we were involved in the creation of Arogya Setu.
Okay.
So, what I can tell you is that in the early days, if we had followed protocol, we simply didn't have the resources to do that kind of quarantining.
Oh,
And then
okay.
NIC took over and I would say changed the protocols, which I understand. On hospital beds, we did something in Bangalore, but then there was a committee which used to sit on top of that, and approximately 30% of beds were being allocated by the committee manually. So when things
Right.
like that come in, technology actually becomes redundant. So
Mhm.
it is the cultural and political system are also such that uh, unfortunately we are resource starved, and in something like COVID and all that, that becomes even more stark. You look at number of hospital beds per 1,000 million, whatever you want to look at, number of doctors, the numbers will be very bad in India compared to most other countries. In fact, we are poorer than Bangladesh. You'll be surprised to know that. So when something like this happens, you can create tech, but there has to be a cultural, political top layer to that. If that top layer is works in its own ways, then the tech won't work. What it will work in, say, a Qatar or a UAE, it will not work here. So even now we find out that even in UK they created one set of rules for the population, and top layer was clearly doing something else. So yeah,
Okay.
we can get back to what you were talking about, Hollywood
Yeah.
movies.
Yes. Yeah.
So
No, it's just that
but
AI. How to?
so okay, I'll
You
go
want to
first on.
continue? Yeah. Sure.
Yeah.
You continue then.
So see, movies or any form of cultural activity, even books for that matter, predict things much in advance. So Jules Verne wrote 20,000 Leagues Under the Sea when nobody had probably thought of what the hell a submarine is. So H.G. Wells wrote 1984. It didn't happen in 1984, but in 2021, that is the description of China. So those things do happen. Uh, I think they help people. So especially for us, it sounds like science fiction. But if you talk to a 12-year-old or a 14-year-old, they are probably more comfortable with AI because of what they have seen in movies. Yes, they believe. We had this funny experience. We also make a lot of robots. So the first time we brought a whole bunch of kids just to measure their expressions, they were like, "Hey, we have seen better in movies. What the hell have you guys done?" So that was quite fun. So for them to see their reaction, I think they will not get it accurate, but building an acceptability within society, I think that function movies do get that accurate. So the I think as far as the adaptability of AI in healthcare is concerned, healthcare is a more sensitive sector. So what do I mean by that? So you have 101 marketing SaaS companies which become an unicorn in 3 years, because if you sell Huggies to an 18-year-old teenager, it is just some marketing dollars lost, nothing else. But if you get AI wrong in healthcare and you do some wrong treatment, that is 5 lives lost. So there's a difference. So the pace will be much slower, regulation will be there, and it is needed. I understand what Arun was also saying earlier, that people are, they don't listen when we say we can do this with AI. How the hell do they trust you? Whether you are a snake oil man or you actually know what the hell you're talking about. Because now even the stock market knows that all you have to do is make 5 AI announcements, your stock price will go up by 10%. That is a studied data, by the way. In 2019, there's a marketing paper on that. They studied announcements and effect on stock price if the word AI was used. And on an average, stock price went up by 5% in the next 2 weeks above market performance if you use the word AI in your publicity. So that's what's the reality. So I think a healthy amount of distrust is good. It may not be good for people like us, but I think it is good for society. So I'll stop there.
Okay, interesting. So, okay, Reshma is going next. Okay.
Sunil, when you were talking about Hollywood and AI, right? I have been very inspired by some of these. I always thought, I'll give you an example, okay? When I first saw the Iron Man movie, there was Jarvis, right? Jarvis is a concept. I'm like, oh, how can this even happen? You talk to something, there is somebody who actually talks like human and then do things for you, right? It's that time it was just a fantasy. But today, if you look at it, that is what all these assistants do. The digital assistants, the Google or Alexa's, that's exactly what they do. They control your lights, they control your washing machine, they control everything the home automation, everything, right? So I think AI or generally technology, I think we need to accept that it is designed to make human lives convenient. I think if we accept that, there's a lot. It's very simple, right? And I mean, when I was a kid, I remember for calling like STD, like from I'm from Kerala, by the way. So from Kerala to say call someone outside, then you or internationally you have to do this trunk booking, right? Trunk calling. So which means that there is manually an operator sitting there, and who is connecting your call. But look at today, right? I mean, we are all sitting in different parts of the world, and I don't even know whether there is a 3 seconds lag between what I am saying and what you're hearing. That is how technology has connected us. Similarly, if you look at it, all these logistics, right? Amazon has a completely robotic, automated, warehouse that they have. Did it take away jobs? Of course, it took away jobs. I mean, did it make common man uncomfortable? It did make. But has it improved the quality of our life? It did improve the quality. And I hope all of us agree with that, right? The only thing that I feel, and now when I talk very specific to healthcare, the problem is, see, AI, like Subhashis was saying that you mentioned AI, there is suddenly a valuation that goes up, or suddenly there is a lot of limelight and attention, right? But AI has been around for a while right now, which means that the technology is robust. It is accessible to a lot of people, right? And when the pandemic happened, there were suddenly an opportunity that was created for a lot of health tech startup, especially working in AI. But what the challenging part is that, see, it's easy to build an AI algorithm. There are some open databases that are available. You can train it. You can train an AI algorithm with as small as 2,000 data to millions of data, right? And what actually differentiates is the amount of data that you have trained it with, the validations that you have done externally. Especially in healthcare, it's very, very difficult to build. You need to have peer-reviewed publications. So there can be like 10 companies which come together and say, come separately and then say that I have the same solution, right? And I can do it for free or with so less cost, whatever that is. But what differentiates one from the other is, and the because we are dealing in healthcare, some factors that you need to consider is that medical device having enough publications, and that publications in a peer-reviewed journal so that is something that you need to look at. Or do you have enough regulatory compliance? Like we at Qure had to invest quite a lot of our time, like many years and effort, for getting an FDA clearance or CE certification, or our compliance like 27,000 ISO 27001, which is more cyber security related, or 13485 medical device regulated, or HIPAA compliance, GDPR compliance, the new compliance that India would be introducing, right? So to kind of adhere to all of that, you need to put in a lot of effort. But the thing is, the moment you say I have an AI solution, I can do this, and so to differentiate a credible versus the other would be the challenging part. Maybe that is why the mistrust is there out there, right? The other thing is adoption. So I think we were talking about, at least for us, we have I mean, there are instances where because of this mistrust, maybe due to all of these factors, the specialists do not want to adopt the threat of missing the job, or the AI taking over. All of that also exists. But the reality is, or I feel, that AI plus humans can do wonders, right? A combination can achieve much more than each of this individually. So that is probably what we should aim for. So I think put all of this together. This is where I mean, this has been some of the pitfalls that, like you mentioned, right? The other part is the data privacy. Of course, I mean, the concerns around who is using my data, what is happening to my data. So I think the organizations, technologies like us, the innovators need to be responsible to address these concerns. So having enough compliance practices, the safety practices, so they need to be responsible from their end to do that. And I think if all of that is there, AI is a good thing. Humans are a good thing. The peer-reviewed publications that I'm talking about, or all these regulatory assessment I'm talking about, it's actually the physicians who needs to be involved and who are involved, right? Which will create that trust. And I think Subhashis was covering another point a little while ago, that but if you actually go to, say, a primary healthcare center, you don't even have specialists out there. So why don't we think about AI as a tool to kind of empower the physicians, or upgrade a physician to a specialist, or enhance the existing specialist so that they can do much more complex things, right? Or prepare for a future pandemic, or something like that. So I'll stop here. Happy to hear everybody else's thoughts.
Okay, I can go next. So I'll start with the movies. I mean, in movies we have seen, AI taking over versus also AI helping a lot. I mean, I remember this movie which excites me quite a lot is this Big Hero 6, right? Where you have an inflatable assistant who is helping the child a lot better. Of course, there was too much drama there, but if you see the essence of it, I think we as public are aware of both what AI good what AI can do good for us, versus there is also a fear that what if it takes over. So I think and also, if there is one more dimension of fear, right, which is either some of the physicians or doctors thinking, will they replace us one day, right? Will my job become redundant? Or the other aspect is, again, will it replace jobs, or will it actually create disasters and do something which Subhashis was mentioning, losing lives? So this is another dimension. I think if I, being a technologist, if I just have a look at it, AI is, highly misrated. Okay, I mean, AI today is no close to, any of those. AI is just like, there were computers introduced back in 80s or 90s, where, bankers were afraid that I'll lose my job. But did they lose their job? No, absolutely no. I mean, if, five people or 5% had, accounts at that time, now everybody has account. And the amount of transactions which you can do today, right, you couldn't do that time. So what AI is doing is to actually reduce cost, or make things more efficient, and take it to a next level or a scale which was not possible with technology per se, not possible earlier. So same thing AI is doing today. Now what we need to do, right, if, and especially if talking in healthcare, I think hospitals or the doctors need to be more made aware of the fact that AI is nowhere, first of all, close to what you think like a real human intelligence, right? It's just, good at performing one single task, better, probably sometimes better than human, achieving better accuracy. But if you look at any other task, it is, it does not know anything, right? So once they're aware of that, these are like probably dumb AI, if I may call it, which is just doing one repeated task very, very well, they'll be at least comfortable that it will not take over. Now the next aspect is, can it really replace my job, right? And that is where I think that aspect, just adopt it, and slowly it has to go. I mean, I'm not sure without awareness what else you can do, about it. So to me, I think there is a lot of awareness which need to be created, about all these, drama which goes around AI taking over or replacing jobs. Okay, at the same time, there are nuances as well, right? I mean, some of, stuff which is being done here, right? For example, diagnosing a patient, okay, and telling a, what does this X-ray has, is a very, very sensitive matter. Now of course they're good at, these algorithms. But what if these algorithms have biases for certain, ethnicity, or certain type of data? What if somebody hacks into it and, just comes in between and, does something? So there is a lot more responsibility which is already talked about, which has to come on the companies who are designing it, to actually think of what wrong it can do, and ensure that you build all those ethical, security layers, and of course, responsibility layers you put on top of it, to see where, how, and in what way it should be used, so that we do not do it. And that's how we'll gain trust of more and more people, as as in they use it. Now, you lose trust if there is one misdiagnosis which happens, right? I mean, you cannot get that back. So you really have to be aware of it and work towards ensuring that you build all those things, to to ensure that, you take care of, this particular aspect of AI not doing any wrong diagnosis, or not taking any decision which could hamper somebody's lives, or forget about life, right? Even doing a small harm or side effect is not acceptable. So I'll rest my case here.
Great. So I'll just close this with, I know we are at the top of the hours, guys, so we'll all have meetings, but I'll just close this with one thing, right? One of the biggest pitfalls has been the abuse of AI. Reshma touched upon it a little bit, right? Uh, then I think Subhashis and Baljit also just touched upon it a little bit. But I think today everybody is an AI organization. Everything is AI based, right? I mean, the abuse of it has been so much, and when people really don't see the value of it, that the trust factor goes really bad. That's one of the challenges that you see as an AI organization all the time. Like everything is AI based. The second thing that comes out is, the pitfall is, how can you be more transparent? Many of the times AI is treated black box, right? How can you be more transparent about what you're doing? I think many companies are not being transparent on how did you arrive at a particular prediction. To a certain degree, you can do that. Yes, you cannot be, you will not probably be able to do show the entire math to the person sitting across the table, but you should be able to show some of the key factors that drove you to that decision. That is not taking away your algorithm from you. I think that some things people are keeping much closer to their heart and making it more black box than it is necessary, which is actually causing us more trouble, because it is allowing others to abuse it, right? Because it's a black box, it's becoming like that. I think that has been a major pitfall that I see, at least in my area of work where I'm talking to people and where we are actually looking at health and health risk assessments. This has been one of our challenges. I think that's what I wanted to put it out there.
So actually, a lot of passionate talk today in the last hour, and I think I had a lot more questions to ask, but we are totally out of time. But still, I mean, before going, maybe in just a 30-second closing, what is the big idea in AI in healthcare over the next decade that's going to take us there? Just within 30 seconds, if you can tell, what is the one big idea that's going to take us there? Then we'll conclude.
Okay, so I will go on that. Firstly, we have talked a lot on diagnostics. I'll cover another area. If you look at nurses, home care, 60 to 70% of the time, nurses do things which are routine jobs. By routine jobs, I mean giving medicine to a patient, giving water to a patient, sometimes even giving an injection. A complex job would be, for example, changing clothes, taking a patient for an x ray, or something like that. As far as routine jobs are concerned, robots can do it. So today, if you look at the Western world, most of them have a population problem, as in their fertility ratios are far less than what it takes to be even. So you solve that problem either by letting immigration happen, to which there is a lot of political resistance, or if you can outsource such jobs. I think there's a large market for such jobs. So imagine a place where a person sitting in the interior of Karnataka is actually I would say, manipulating a robot sitting in an elderly person's house in Japan. It's very much possible. You need a lot of things. You need 5G, you need Japanese to Kannada translation, you need NLP at a different level, but it's possible. That can revolutionize healthcare. That is one. And second thing, a lot of people are talking rightly about, yes, what can AI do, all the dangers, but look at a game theory approach to it. If we don't do it, by we I mean as a country, if India doesn't do it, will it stop others from doing it? No, it will happen. So game theory says if it happens elsewhere, then we will import it. Can we make a search engine today? No, we can't. No country in the world can. You can't compete with Google, the kind of data they have, irrespective of how good of an algorithm you come up with. So either we make it and export to the world, or they will make it and send to us. So that's the call we have to take. There's no third option. This is, oh, I am very nice, I want to protect this and that. Doesn't happen. This is the real world, and game theory tells us it will happen. So you are better off putting in all the protections, whatever you want to do, but let it develop so that you can export to the world. Because if you don't, you will import it from the world. That's all I have to say.
If I have to say on a top level, again, I'll touch on the technology. I think all other aspects are being covered. I would say explainable AI, which is very, very important in healthcare. Whatever you do, can you explain why, whatever decision you arrive, why did you arrive at it? Because, that's the next step in AI. Okay, so that people can trust you, medical fraternity can trust you, and data. I think one big revolution which we'll see in healthcare, in especially in India, would be tons of data. I just hope that it is made available to public so that innovation can happen. What otherwise, what good is that data? So these are the two things I would say for this decade.
Okay,
Arun,
let me go. Yeah. So I think uh, for me, the biggest use case of AI in healthcare and where it'll go is meaningful use, right? When I say meaningful use means
think I think he's gone. I think, yeah, maybe Reshma, you can finish. I don't know when he'll return.
I was hoping to hear what he had to say, but probably because where we are today, like Qure is today, uh, at least what one of the big things that we hope to work, or we see the world to work, is towards an integrated screening, or integrated multi-disease screening, or kind of more moving towards a prevention approach, right? What I mean to say is that We all go to, say, hospitals. I go to hospital when I have like a cough, but I'm going to hospital with a specific symptom that I'm talking about, right? But I could have many underlying diseases that are out there. Do I go to hospital, probably, X-ray, or, get your blood sample and get your path test or radiology examinations, and then look at that? And usually what happens is that it is diagnosed for what I have originally shown symptoms. But there could be many, it could be also like onset of many other diseases, which I don't even know about, right? Or I'm not even showing symptoms. So an approach where single time you go to hospital, you are screened for everything, and all these underlying issues are picked up much early on. You can be put on treatment much early on, is something you really hoping that we can work towards, or the world will work towards that, right? So that is one major area of focus that we have. And for this to happen, what we need is, we need government, we need academia, we need technology partners, we need non-governmental partners who can implement all of this to come together. And we need to have, like, say, policy level changes that happens. So for example, we work in TB, we work in COVID as well, right? COVID plus TB can be an integrated screening, is something that happened now, but is what we wanted to do before. Or look at, say, lung cancer for that matter. So we have individuals, we have several TB programs that are running there, which are looking at TB as an indication, right? But they might have, say, lung cancer, because some of the symptoms and risk factors overlap. So instead of sending that individual saying that, hey, you don't have TB, what you probably need to look at, you are probably, say, 45 years and above, you have these issues, maybe you have an underlying cardiac issue, right? Or maybe you have an underlying, you might have lung cancer. So these are some of the things that you could pick up. So kind of more, I would say, single step, or like one stop complete screening, or multi-disease screening. That's something which I'm really hopeful to see in the coming few years.
Yeah. So I think, Arun, you get the last word then, finally. Hi, Arun. Can you hear us?
No, I think,
Yeah.
yeah, I was trying to say about meaning. I can hear you guys. Can you hear us?
Yeah.
Yeah,
Please,
perfect.
continue.
So I think I was talking more about meaningful use of AI, meaningful use of AI, where we actually ensure that we are using AI more ethically in the healthcare system. Because once it becomes prevalent, there is a very big chance of misuse of AI for different purposes. I think that is the biggest hurdle for us going forward, and that is where we should start looking at setting our AI context for, is how can we use AI meaningfully so that it affects the common man on a day-to-day basis. That's all.
So I think with that we conclude. I'd like to thank our academia partner APG Education. I'd like to thank the audience, and finally I'd like to thank the entire panel. It was a very engrossing discussion. I'm sure we can even have a 2-hour discussion. So I hope listening more to all of you in the future. Thank you so much for your time. It was a great discussion.
Thank
Okay.
you. It was great
Thank you,
to.
Sunil.
Thank you,
Yeah,
Sunil.
thank
Bye.
you.
Bye. Thank you.
Bye.
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 Thank you, Sunil.
Bye.
Thanks, everyone.
Thank you, everyone.
Thank you, everybody. Bye bye.
Have a good one.
Yeah.